So, what is the Mediterranean diet? It's a term that was coined for this style of diet. This diet is also recommended by the United States Department of Agriculture, and they do a ton of research, study other research by other companies, corporations, and groups that includes a very plant based foundation. And let's break the rest of the pyramid down into its components. If you look at the very, very bottom, the foundation, it focuses on getting rest, physical activity, and also socializing with family and friends. Very important foundational things. And yes, it's all related to your diet and your health. Then, if you notice, it also states that food should be obtained in a way that's healthy for the environment, eco friendly, traditional, local, and biodiverse, also seasonal. So it goes deeper than just the actual food products. It also encourages enough water. So these are basic things, foundations to the triangle. And you can see here this environmental pyramid, which is a comparison of the Mediterranean diet with its effect on the environment. And as you can see, the base of the triangle is fruits and vegetables, and that has the smallest effect, negative effect on the environment. Red meat, slaughterhouses, pollution, bad conditions, as well as abusive working standards has the worst effect on the environment. So if you can see that, you can see that through and through, the Mediterranean diet is very, very good for the individual and society as a whole. Also, it's a really great idea to screenshot this so you can see that every meal, every main meal should include these requirements: 1 to 2 fruits, greater than 2 vegetables, variety of colors, raw, some cooked, different textures. And then every day you should have 2 servings of dairy and olive oil or nuts and seeds, as well as weekly. How much of these various components should you have? So, this is a great breakdown, which will kind of help you to figure out the daily versus the meal versus the weekly components. Here on the other side, you can see that it advises wine only in moderation. And if you don't drink, don't start drinking. Very low sweet contents, very low red meat, processed meat. Also, herbs, spices, garlic, onions, less added salt is a major part of this, as well as olive oil, healthy whole grain breads, pastas, rice, couscous. Also incorporates a lot of very healthy fats. Contains more fish than most diets and way less red meat and sugar than most diets. This diet lines up with the USDA recommendations. This is extremely important evidence based medicine. The medical profession only recommends diets contained in this pamphlet. Unless you have a medical condition that warrants a very special diet that is prescribed to you, then you should really adhere to one of the dietary recommendations here. Basically, it's very basic. It focuses on what the human body needs to be its most healthy, to be its most happy. There is a new version coming out in 2026, which is currently being compiled, but it's going to be very similar to this previous one. Basically, the key principles: we are limiting added sugar and added sodium. We are eating a variety of fruits and vegetables, all different sorts of things. We want to make sure to get what we need, what the human body needs from its diet in our foods. So you don't have to take too many supplements or multivitamins. Maybe one multivitamin is a good idea, but the diet should be the main source of all your nutrition. Also, portion size, because eating too much is very unhealthy. This is to live. We eat to live. If this becomes one of your main joys, um, as it should be, but you need to make sure to look forward to it enough and really enjoy it and keep it light so it doesn't cause you health complications. Here you can see that most people do not adhere to the guidelines. This is an absolute emergency. It is devastating to see the state of the healthcare system and people coming in with a lot of preventable chronic illnesses and injuries because they had a poor diet. They didn't eat well. They didn't understand nutrition, the basics, or the positive outcomes that will result if you get your diet healthy. Less processed foods, more vegetables. It's a great idea, if you don't know this, to screenshot this, because one of the main foundations of the diet is vegetables. Also, a lot of fruits, very healthy for you unless you have a sugar processing condition such as diabetes. But even then, you should include some fruits.
Very healthy, part of the foundation of the diet. Grains are important. Cutting them out is not a good idea. It's very important to also maintain your cardio, your health. To do that, you need to eat grains. That is why carnivore and keto is not ideal because you will be unable to complete proper exercise needed for the human body. So whole grains, very important. Refined grains as well can be included, but not as much because they're not as nutritional. Some dairy is advised and protein foods as well. Nuts, seeds, and soy are one of the larger recommendations for your protein source. And then comes seafood, then comes eggs, and then the red meats and the chickens. So all of these are good for protein, but really the more plant-based sources are more ideal.
A United Nations group had noticed that America was falling very behind in health statistics and health markers, right? But Europe, Spain, Italy, Greece, Morocco, France, they were doing way better as far as like health markers, health indicators, mortality statistics, cancer statistics, things like that, basically cardiovascular disease. This was noticed because it was a dramatic difference, and there was a large meeting of all of these major heads of various countries, and they came together and they did coin this term, the Mediterranean diet. It's kind of, we're not like directly adhering to what they eat in Italy kind of thing. We're taking from all these areas in Europe and we're noticing that, hey, they eat very plant based. Plant based does not mean vegan. Plant based does not mean that is all I eat is vegetable products. No, it is plant-based. The basis of it is rooted in, very healthy, colorful vegetables, fruits, as well as legumes, so beans, right? So that's a great protein source. And then you have all of these antioxidants and polyphenols in the vegetables and fruits as well. Here's a great diagram of what comprises the Mediterranean diet. You can see there is very little sweets and red meat. This is a point of confusion for a lot of people. Red meat is not big in the Mediterranean diet, and neither are processed foods or added sugars. Those are very, very minimal because those are not good for human health. So, one of the key markers of this diet is a lot of olive oil. Actually, in these countries, supposedly they eat olive oil with every meal, like a third of a cup. And, it does seem to be helping their cardiovascular health and length of life as well as quality of life. So, this is kind of reminiscent of the blue zone kind of topic, countries where people live to like 120, things like that, like Okinawa, when there was like a green tea and a rice kick. That's still obviously going on, but this is also extremely healthy. The key of this diet is this kind of like it is a form of like a non-diet diet. So you're eating sufficient calories and you are full, but you are healthy, so you can work out a lot. Also, it's a very social kind of a diet. It focuses in on the fact that meals should be, we should hold on to that traditional aspect of a meal where it's a family thing and we all gather around. And wine is not encouraged, but it is okayed. So if you already are a drinker or you do have like parties and things like that, wine is accepted. But if you don't drink, you're not supposed to start drinking. So don't confuse, the recommendations to say, oh, we have to drink a drink every day. No, that is not the case. But mostly it's for the social aspect. And really, though, if you're not a drinker, you're not supposed to start drinking. That's a major point. Just briefly, their lives are longer in these countries. They have a higher quality of life. They are not so stressed.